sternal notch. From the clavicle, move medially until you feel a depression between the two clavicles. That is the jugular or sternal notch. To palpate the angle of fluvi, from the jugular notch, move inferiorly and you will feel a dent. That is the angle of fluvi or the sternal angle. To palpate the xiphoid process, from the jugular notch, move inferiorly until you palpate the angle of fluvi and then move inferiorly again and then you will feel a depression. That is the xiphoid process. To palpate the sternal end of the clavicle, from the clavicle, move medially until you feel a bony prominence, and that is the sternal end of the clavicle. To palpate the acromial end of the clavicle, from the clavicle, move laterally and you will feel a bony prominence at the end of the clavicle, which is its acromial end.
To palpate the spine of the scapula, we will start from the acromial process and we will move posteriorly, medially, and slide to the spine. To palpate the vertebral border of the scapula, we will ask the patient to put his hand on the small of his back, and then from the spine of the scapula, we will move inferiorly, and this will be the border of the vertebral border of the scapula. To palpate the inferior angle of the scapula, and if we reach the end, we will feel the inferior angle of the scapula. To palpate the axillary border of the scapula, if we move laterally and superiorly, we will feel the axillary border of the scapula. To palpate the superior angle of the scapula, we will start again from the spine of the scapula, go medially and posteriorly, and if we move superiorly, we will feel the end of the scapula, that is the superior angle of the scapula. To palpate the acromion process, we will start from the jugular notch, go laterally along the clavicle, you will feel the acromioclavicular articulation, and then after that, you will feel the acromion process. To palpate the coracoid process, in the lateral most aspect of the clavicle, lower your fingers distally, approximately 1 inch, and push your fingers laterally and posteriorly, and you will feel the coracoid process.
To palpate for the greater tuberosity, from the jugular notch, move laterally up along the clavicle until you reach its acromial end. Then from the acromial end, move inferiorly where you will feel a bony prominence, that is the greater tuberosity. To palpate for the bicipital groove, from the greater tuberosity, the patient's elbow is flexed and then laterally rotated where you will feel first a dent, that is the bicipital groove. To palpate for the lesser tuberosity, then from the bicipital groove, move anteriorly where you will feel a bony prominence, that is the lesser tuberosity. To palpate for the deltoid tuberosity, from the jugular notch, move laterally along the lateral end of the clavicle, that is the acromial end. Then from the acromial end, move inferiorly towards the lateral half of the humerus, where you will feel a bony prominence, that is the deltoid tuberosity. To palpate for the spiral groove, from the acromial end of the clavicle, move inferiorly towards the deltoid tuberosity. Then from the deltoid tuberosity, move posteriorly and slightly superiorly, and that is where you can locate the area of the spiral. To palpate for the medial epicondyle of the humerus, from the medial side of the humerus, move distally towards the medial side of the elbow where you will feel a bony prominence, that is the medial epicondyle. To palpate for the lateral epicondyle of the humerus, from the lateral side of the humerus, move distally towards the lateral side of the elbow where you will feel a bony prominence, that is the lateral epicondyle.
To palpate for the trapezius, for all the fibers of the trapezius, ask the patient to abduct the shoulder and then put resistance. You can see the upper trapezius, middle trapezius, and the lower traps. And to palpate the upper trapezius, put your hands on the shoulder, on the patient's shoulder, and ask the patient to shrug the shoulder with resistance. 1, 2, 3, 4. To palpate for the middle trapezius, ask the patient to abduct the shoulder and put resistance. And to palpate for the lower trapezius, palpate the inferior angle of scapula. Then ask the patient to depress the shoulder. To palpate for the rhomboid minor and major, ask the patient to put his hand at the back, palpate the medial border of the scapula, and then ask the patient to lift his hand from the back. To palpate for the pectoralis minor and major, to palpate for the pectoralis major, just ask the patient to push the both palms of the hands together, and you will see the pectoralis major pump out. To palpate for the isolated pectoralis major sternal fibers, ask the patient to abduct or downward in his hand with resistance, and you will palpate to the upper border of the chest. And for the clavicular fibers, just ask the patient to abduct and upward in with resistance and palpate below the clavicle. For palpating the pectoralis minor, go find the coracoid process by going to the deepest concavity of the clavicle, then go downward. Ask the patient to put his hand at the back, and ask the patient to lift his hand and put resistance on it. 1. Then you can feel the pectoralis minor contracting. To palpate for the supraspinatus, palpate the spine of scapula, then go above the spine of scapula. Ask the patient to lean forward. Then ask the patient to relax and slightly abduct the arm. To palpate for the infraspinatus, with the spine of scapula, then go inferior to the spine of scapula. Ask the patient to lean forward. Then ask the patient to put his palm upward and externally rotate the arm. You can also do it by resisting. To palpate for the teres minor and major. For the teres minor, look for the patient's lateral border and of the scapula, and in the upper 2/3, palpate the teres minor. Ask the patient to bend forward, then resist the arm while rotating the palm upward. And for the teres major, just go downward to the teres minor, the lateral third downward, and then ask the patient to downwardly palm, to rotate the palm downwardly and put resistance.
To palpate for the serratus inferior, use posterior to the pec major, distal to the axilla in the area of the 1 to 8 ribs, and you will have the patient scapula, arms forward, then shoulder external rotation. Then I want you to do the motion by reaching upward. Then I will resist it. 1, 2, 3, go ma'am. Pause. To palpate for the latissimus dorsi, ask the patient to put her hand on my shoulder. So ma'am, put your hand on my shoulder. Then palpate posterior to the axilla. Then ask the patient to press her hand on my shoulder. So ma'am, press niyo po yung hand niyo dito sa may dito. Press niyo po pababa. 1, 2, 3. To palpate for the levator scapulae, the levator scapulae is posterior to SCM and anterior to the trapezius line. So, ask the patient first to rotate her head on the right side and bend on the same side to find the SCM. So, this is the SCM, posterior to it, and then this is the trapezius line. Go anterior, then ask the patient to put her forearm on the small of her back. So, ma'am, put her forearm on the small of her back. Then ask the patient to do quick, small, effortless shrug. So, ma'am, shrug po tayo, parang small lang, parang effortless, bilisan lang. scapular fossa. Then ask the patient to internally rotate the shoulder. So ma'am, I want you to turn your palms down, then I will resist it. 1, 2, 3, go. 1, 2, 3. So to palpate for the deltoid, for all the fibers of the deltoid, have the patient abduct her shoulder. So ma'am, ito pong shoulder, i-dalay po natin siya sideways. Then, I will resist it, ma'am. 1, 2, 3, go. This is all the fibers of the deltoid. To palpate for the anterior fibers of the deltoid, resist horizontal adduction. So, ma'am, yung si shoulder po natin, si arm po natin, ilalagay po natin dito sa may kabilang side. 1, 2, 3, go. This is the anterior fibers of the deltoid. The middle fibers of the deltoid resist abduction of the shoulder, and the middle chunk is the middle deltoid. So, ma'am, ito po si arm pataas po. Pipigilan ko 1, 2, 3, go. This is the middle deltoid. For the posterior, to palpate for the posterior fibers of the deltoid, resist horizontal abduction. So, ito po si arm papunta po sa likod. Pipigilan ko 1, 2, 3, go. Posterior. To palpate for the coracobrachialis, as the patient remains sideways. Then, it is below the pex boundary and the biceps boundary. As the patient to horizontal abduction, I want you to put your arms towards your left side like this, and then I will
To palpate for the ulnar nerve, slightly flex the patient's elbow, and then palpate for the medial epicondyle and the olecranon process. Between the medial epicondyle and the olecranon process, you will feel a cord-like structure, and that is the ulnar nerve. To palpate for the olecranon process, slightly flex the patient's elbow, and the bony prominence of the posterior aspect of the patient's elbow is the olecranon process. To palpate for the olecranon fossa, from the olecranon process, move slightly proximally and you will feel a dent, which is the olecranon fossa. To palpate for the radial head, from the lateral epicondyle, move a little distally until you feel a joint line. Then move a little distally again until you feel a bony prominence, which is the radial head. To palpate for the biceps brachii, belly, and tendon, tell the patient to make a muscle and then resist the patient's flexion. The muscle bulk is the biceps brachii, belly. Then move distally into the middle of the elbow where the tendon pops out, and that is the biceps brachii tendon. Tell the patient to make a muscle, then resist the patient's flexion. From the biceps tendon, move medially, and then relax the patient's arm. You will feel a pulse from the brachial artery.
To palpate for the bicipital aponeurosis, ask the patient to make a muscle. Then resist the flexion. Then from the cubital fossa, move distally, and this is where the bicipital aponeurosis. To palpate for the brachioradialis, position the patient's forearm in mid-prone. Then ask the patient to bend her elbow with resistance. The first muscle that pops out is the brachioradialis. To palpate for the extensor carpi iridalis brevis muscle and tendon, grasp again the radial group. Then from the brachioradialis, position the forearm into pronation. Move posteriorly, you'll feel a border, and then move again posteriorly, another border. Then near that is the belly of the extensor carpi radialis brevis. And for the tendon, ask the patient to extend their fingers and then abduct the thumb. Then from the base of the third metacarpal, you feel the tendon is moved. the patient to bend her elbow with resistance. Grasp the radial group. Then from the brachioradialis, position the patient into forearm pronation. Then move posteriorly. Then ask the patient again to make a fist. Extend her wrist with resistance. And for the tendon, from the base of the second metacarpal, again make a fist and then extend her wrist with resistance. To palpate for the triceps, ask the patient to extend her elbow with resistance. We will see the triceps brachii here. For the long head of the triceps brachii, palpate the posterior surface of the arm near the axilla. For the lateral head, move laterally and on the lower half of the humerus. For the common tendon, move distally and you'll feel a depression. Then move again distally. For the medial head of the triceps brachii, ask the patient to put her palm upward on a table. Then from the medial epicondyle, move proximally. Then ask the patient to actively extend her elbow.
To palpate for the ancones. Between the olecranon process and the lateral epicondyle, you move slightly distal. Now you will ask the patient to extend the elbow while there is a resisted force. To palpate for the pronator teres, use the four-finger technique. The thumb represents the approximate location of the pronator teres. To feel the flexor component of the pronator teres, you ask the patient to flex her elbow while there is a resisted force. Next, to feel the pronator component of the pronator teres, you ask the patient to pronate her forearm while there is a resisted force. To palpate for the palmaris longus, use the four-finger technique. The middle finger represents the location of the palmaris longus. Now, to look for the tendon of the palmaris longus, you will ask the patient to flex her wrist while there is a resisted force. Now, the tendon medial to the flexor carpi radialis is the palmaris longus. To palpate for the flexor carpi radialis, use the four-finger technique. The index finger represents the flexor carpi radialis. Now, to see the tendon, you will ask the patient to actively flex her wrist while there is a resisted force. The lateralmost tendon is the flexor carpi radialis. To palpate for the flexor carpi ulnaris, use the four-finger technique. The ring finger represents the approximate location of the flexor carpi ulnaris. Now, to feel the tendon of the flexor carpi ulnaris, you will ask the patient to flex her wrist while there is a resisted force. Now, the medialmost tendon of the forearm is the flexor carpi ulnaris. To palpate for the pronator quadratus, this is the approximate location of the pronator quadratus. Though it cannot be palpated, you can see its functionality once you ask the patient to slowly and actively pronate the forearm without any resistance.
palpate for the distal tubercle or the dorsal tubercle. Start with the third MCP. So this is the third MCP of the patient. Go proximal. You will find a bump. That is the distal tubercle. To palpate for the radial styloid process, go to the radial side of the forearm. So this is the radial side of the forearm. And then go distal. You will find a sharpened end at the distal part of the forearm. That is the radial styloid process. To palpate for the supinator, the radial group should be pulled as much as possible. So first, find the brachioradialis of the patient. The forearm should be in mid-prone and then flexion of elbow. So ma'am, ang gagawin niyo po, ayan, nakaganyan ang hand niyo, tapos tutupi niyo po pagkat. Tapos bibigyan ko po ng resistance. 1, 2, 3. So this is the brachiorad, and then pull it as much as possible. Ayan, relax na po ma'am. And then, ask the patient to pronate the forearm. So, ma'am, ipaganda niyo po yung kamay niyo. Ang gagawin niyo pong action is, ipapaangat niyo po yung kamay niyo. Slowly lang po. Okay? 1, 2, 3. That is the supinator. To palpate for the first carpometacarpal joint, start with the first digit of the patient. So, this is the first digit of the patient, or the thumb. Go proximal. And then you will feel at the base of the thumb, you will feel a joint line. The joint line is for the first CMC joint. To palpate for the anatomic snuff box, resist IP extension. So ma'am, ang gagawin niyo po, ipapaganon niyo lang yung thumb niyo. Tapos I will place the resistance on the IP of the patient's thumb. So ma'am, go na po, bibigyan ko po ng resistance. So this is the anatomic snuff box of the patient. This is the ABB tendon, EBB tendon, and then EPM tendon.
To palpate for the lunate, from the ulnar head, slide laterally towards the dorsal tubercle, and then move distally where you can feel a dent. That is the area of lunate. To palpate the capitate, from the third MCP, move towards its base where you can feel a depression. That is the area of capitate. To palpate the pisiform, from the ulnar styloid, move towards the palm where you can feel a bony prominence. That is the pisiform. To palpate the hook of hamate, place your thumb IP at the pisiform pointing at the first web space. At the tip of your thumb, you will feel a bony prominence. That is the hook of hamate. To palpate the triceps, from the ulnar styloid, move distally and then radial deviate the wrist of the patient. A bony prominence will pop out, that is the triceps. To palpate the scaphoid, from the radial styloid, move distally towards the base of the anatomical snuff box where you can feel a bony prominence, that is the scaphoid.
Palpate the ulnar artery. From the ulnar head, go laterally, you will feel the pulse. This is the ulnar artery. To palpate the radial artery, ask the patient to supinate her forearm. From the radial styloid, go medially, you will feel a pulse. This is the radial artery. To palpate the extensor carpulnaris, distal to the ulnar styloid, ask the patient to make a fist and extend his hand and ulnar depth, and I will make a resistance. You will feel the extensor carpi ulnaris contracting. To palpate the extensor digitorum, ask the patient to abduct her finger, and then I will give resistance, and then ask the patient to extend and finger extend. Go, ma'am. And you will see the tendons pop out, the extensor digitorum tendon. To palpate the flexor digitorum superficialis, between the palmaris longus and flexor carpi ulnaris, ask and stabilize the hand and ask the patient to flex his finger. You will feel the contraction of FDS. To palpate the flexor digitorum profundus, palpate the proximal phalanx and stabilize the middle phalanx and flex the finger. You will feel the flexor digitorum profundus tendon is contracting.